all. My name is Dr. PJ Madan Rafi. Today we are going to discuss about anti-epileptic drugs. So first we will see seizures. So what is seizure? Seizure is a paroxysmal abnormal discharge at high frequency from an aggregate of neurons in cerebral cortex. That means abnormal discharge of neuronal signals from a set of group of neurons in the cerebral cortex is known as a seizure. So if this seizure is happening recurrently, then it will be called as epilepsy. Okay. Then if epilepsy is happening with involuntary, violent, spasmodic muscle contractions, then we call it as a convulsions. Okay. So how these seizures will happening? What are the main neurotransmitters will be involved here is there will be excitatory neurotransmitters like aspirate, glutamate, and inhibitory neurotransmitters like GABA and glycine, and there will be two electrolytes will be involved in this formation of seizures, that is sodium and calcium. So drugs should be acting on these receptors will control epilepsy. Okay. So before discussing all this, we will see what are the types in normal seizures. There will be two types: generalized seizures and partial seizures. In generalized seizures, it's a first type is GT seizures, that is grand mal tonic-clonic seizures, absence seizures, myoclonic seizures, akinete seizures, clonic seizures, tonic seizures. Okay, in partial we have simple partial, complex partial. So what are the drugs? There will be group of drugs will be there, so they will act with different mechanisms. So previous slide we will discuss it. What are the main neurotransmitters and electrolytes involved there? Excitatory and inhibitory, and electrolytes come to sodium and calcium. So the drugs will be acting on these neurotransmitters and electrolytes only. They will control the epilepsy condition. So first, inhibition of sodium channels, because when you are inhibiting sodium, there will be no depolarization, so there will be no high frequency of discharging will be there, so there will be no triggering point, so there will be epilepsy will be controlled. So what are those drugs will have? Phenytoin, carbamazepine, valproate, topiramate, lamotrigine, and lacosamide. Next, enhancements of GABA. GABA means it is a inhibited neurotransmitter. So in that what will have? Phenobarbital, benzodiazepine, gabapentin, vigabatrin, tigabayne, valproate. Next, blockade of NMDA or AMPA. Why NMDA this should be blocked? These are excitatory. So we should inhibit the excitatory, enhance the inhibitory. Okay, that means we have to inhibit the inhibitory, excitatory. We have to enhance the this one. Okay. So in blockade of NMDA or AMPA receptors, what are the drugs will have? Felbamate, rufinamide, lamotrigine. Because these are excitatory, that's why we are blocking it. Next electrolyte will be calcium. In calcium, we have two types of calcium channels, N-type and T-type. So blocking of calcium, N-type calcium channel will be lamotrigine and gabapentin. Blocking of T-type calcium channel will be ethosuximide and valproate. This is the last. sp2a protein will be, this is the recently developed molecule. It will act on selective binding to the synaptic vesicular protein. It will be acting on the synapse. Thereby it will decrease the glutamate release and increase GABA in the synapse. That means glutamate is a excitatory, GABA is a inhibitory. So decreasing excitatory, then enhancing the inhibitory. Same mechanisms. Okay. So we have to remember the names and the main different mechanisms. They will ask, maybe they give the name and they will ask the mechanism of action. So you have to know the main mechanism of action of different drugs. Next, we have so many drugs, so we will discuss main important drugs in the class. So first main here is phenytoin. It is a non-sedating oral anti-epileptic drug. So epilepsy is an emergency condition, so we have to be parental form. So the parental form will be phenytoin. It is having anti-arrhythmic property, that is class 1B. Next, it has enhanced wound healing property. Here they will ask mainly the adverse effect of phenytoin. Mainly previously they are asking the gingival hyperplasia will caused by phenytoin. Now they are asking reason. What is the reason? Enhancement of platelet derived growth factor. And what are the other adverse effect we have here? Hirsutism, coarsening of facial features, megaloblastic anemia, osteomalacia due to vitamin D deficiency, hyperglycemia due to insulin inhibition of insulin, then fatal hydantoin syndrome. That's why we should be cautious in giving in pregnancy. pregnancy, then vitamin K and vitamin D deficiency. Here MCQ will be focused on ADRs, mainly the reason for the gingival hyperplasia and what are the other actions of phenolidine like antiarrhythmic, and it is having a wound healing property. Next. So next drug will be important, carbamazepine. It's analog oxcarbamazepine. So it will act as anti-epileptic by blocking sodium channel. So by blocking sodium channel, it will inhibit the triggering of neurons. So it is a drug of choice for partial seizures and trigeminal neuralgia. It is also used in post-herpetic neuralgia, that is painful conditions. Next is varicella zoster induced post-herpetic neuralgia. Next, treatment of bipolar disorders. And it is these drugs are a potent enzyme inducers. So you should be cautious when you are adding with other drug because it will form drug-drug interactions. Okay. So what is the major adverse effect of this carbamazepine, oxcarbamazepine? It will induce leukopenia, aplastic anemia, SAS like Steven-Johnson syndrome, and it will be hepatotoxic. So you should be cautious when you are prescribing to the liver patients or some blood disorders patients. Okay. Next main important drug will be valproic acid. Valproic acid will act by three different mechanisms. Okay. So they will ask here whether they will add anything more mechanism of action. Thereby they will give an MCQ. So it will act by main three different mechanism of action. That is, first one is inhibition of sodium channel, thereby decreasing triggering of neurons. Second, enhancement of inhibiting neurotransmitter, that is GABA. At the same time, blocking of T-type calcium channels. Okay, they do not block N-type, they block only T-type calcium channels. So drug of choice is all type of general seizures like GTCS, myoclonic, atonic, atypical, absence, clonic, tonic, and Lennox-Gastaut syndrome. This is a pediatric age group people. They will have epilepsy condition between 2 to 6 years age group. Okay, this is recently diagnosed one. So they can ask this question: Lennox-Gastaut syndrome will be seen in which age group, and what are the drug of choice? Valproic acid. Okay. So what are the other indication of valproic acid? Will be bipolar disorder, prophylaxis of migraine we can use, trigeminal neuralgia condition, and tardive dyskinesia. Okay. Here you should remember the different mechanism of action of valproic acid. That is blocking of sodium, blocking of T-type calcium. Third one is enhancement of GABA. Okay. Next. So here some of the main drug of choice drugs. So what will you have? Ethosuximide is drug of choice for absence seizures. This is the most repeated MCQ. Then vigabatrin for infantile spasm, lamotrigine for absence seizures, mania, and they will have recently asking the ADRs of lamotrigine. It will induce TEN, toxic epidermal necrolysis, Steven-Johnson syndrome. These are two are very serious conditions, so we should be very cautious. Next, gabapentin. It is a drug of choice for diabetic neuropathy. Most commonly we use this one, and post-herpetic neuralgia. Next, this is the recent drug steripental. It is a drug of choice for Dravet syndrome. This is also recently diagnosed one. Dravet syndrome. Dravet syndrome means it will be happening in less than 1 year children. Okay, here only one half of the half side of the body only they will have seizure episodes. Half side of the rest of half will be normal only. So this is a some typical condition. So they can have chance to ask this one. Steripental is a drug of choice for Dravet syndrome. And Lennox-Gastaut syndrome also there will be two drugs. One is rufinamide, cannabidiol. Will previously valproic acid also we can use. Okay. So in this mainly steripental, rufinamide, cannabidiol. Cannabidiol is it's a cannabinoids analog drugs. They can also use for Lennox-Gastaut syndrome. Okay. So next last topic is epilepsy in pregnancy. So how do you treat pregnancy patients? If if patient is known case means he already diagnosed having epilepsy chance, so she is already an anti-epileptic drug. So continue the same drug. So if during the pregnancy only she is diagnosed newly, then we should go with carbamazepine. This is a safe drug. Second drug of choice will be lamotrigine because it will have wide spectrum of activity. So you can use in different types of seizures also. So here when you are prescribing these drugs, mainly focus on folic acid supplementation because to prevent neural tube defects, should be given folic acid. So when patient is an already anti-epileptic, continue the same. If patient is recently diagnosed, then you will go with carbamazepine or lamotrigine, or and with adding of folic acid supplementation. That's all. Thank you.